Good afternoon, everyone. Welcome to our Emory Living with MCI Dementia webinar series. My name is Alice Cooper Salisbury, and I am a clinical social worker in the Cognitive Neurology Clinic. I am joined by my colleagues Ashley Varner and Debbie Arnold, who are also clinical social workers. What we have here today is a webinar series that are based on topics that have that seem to be important for people who are living with MCI and dementia. They're gathered, the topics are gathered from people we've been in contact with, and so with you. So hopefully, if there are any other topics that you would like us to talk about, that you'll reach out to us and let us know so that we can find someone to present. This is a webinar, so you are not on screen as participants. There's no video and there is no audio, but we do want you to participate. So please, 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 in the question and answer, the Q&A box, please put in your questions. Put them in throughout the presentation today. They will not be answered until the end, but we don't want you to wait to put the questions in. Go ahead when you're thinking about it, go ahead and put them in so that we can get them answered. And so now I will turn it over to Debbie Arnold.
Hey, good afternoon. I am really thrilled that we have Christy Height joining us today to talk about adult day programs and the benefits for our community. Christy is the program director for Peachtree Christian Health Adult Day Center in Duluth, Georgia. And she has quite a diverse background in education as well as management. And she came around to this work in a really interesting route. She's worked in various capacities with higher education and government, in the private sector and in nonprofit. But she actually began at the UGA Extension Service in environmental education, horticulture, and youth development before transitioning to direct landscape management with a professional firm. And then her commitment to client and employee satisfaction there helped her allow that company to thrive in spite of the economy at the time. But while working closely with clients, this interest in using horticulture for therapeutic purposes began to flourish, and she pursued a degree in horticulture therapy at the University of Kansas before opening her own business, bringing therapeutic horticulture activities to older adults in various settings, in assisted living, in memory care, and in hospice inpatient residences. And now, as program director of Peachtree Christian Health, she synthesizes her diverse backgrounds of curriculum development, of program development, and her love for serving older adults into this meaningful and sustainable day program that really is an asset for the families that she serves. So I'm thrilled to have her expertise today. And welcome, Christy. Thank you for joining us.
No, thank you. Thank you. Yes. So never stop learning and never stop growing and moving, right? So I did start off in a different area, but found my niche here and just love it. So thank you for having me. And then you wanted me to go ahead and start with the
yes, if you can go ahead and
I will share my screen and get started with you all. Thank you for having me.
Great.
Let's see. Well, it's not, it's shared. Oh, there we go. Okay, can you all see it?
We can. Thank you.
Okay, so I've been asked today to speak on adult day care programs and what you need to know. So we'll go through today. Oh. Let me see if it'll advance for me. Not advancing there we go. So today I'll try to cover what Adult Day is, Adult Day health programs, the differences between them and other programs you may be familiar with senior centers, congregate respite centers. What we do with Adult Day, the benefits of Adult Day, when to consider Adult Day, how to choose it, and questions to ask. So as you have questions, I know we'll wait till the end, but please don't hesitate to ask as I try to cover those topics. First of all, Adult Day Adult Day services kind of came around about 50 years ago. They provided outpatient support services for older adults to help them with their functional limitations, and also to stay in the community and reduce caregiver burden. Those were kind of the two purposes that served. Currently, most Adult Day programs will have some type of activities in a safe environment, a group setting for older adults. Most people who come, to ours and others need some type of supervision. Maybe they don't want to be alone, or they're unable to be alone. And they also get some socialization. Most Adult Days are during the day. Some are longer than others. Some are open for maybe 5 hours, different parts of the day as well, some a couple days a week and some longer. To compare the different types, senior centers, we kind of call those, step one maybe is getting involved in a senior center. Most people are familiar with those, run by the county governments usually. The licensed facility, it's not a licensed through the Department of Community Health as the Adult Day programs are. Trained staff, they have professional staff. They may not go through additional training or clinical training, besides a first aid and stuff. They do provide meals. They have classes. They're a great option for those who are independent in their care. They may live independently, need socialization, need just something to do to stay busy. There's another type of program that's coming around you may have heard of, that's the congregate respite programs. A lot of churches will start these programs. They see a need with their aging population. They might have a congregate respite program. Those are smaller. They're usually run out of a church or other community building. They're run by volunteers primarily. They may have one program director. They offer educational classes, respite for caregivers, a social environment. They sometimes provide a meal. I know it says that they don't. They sometimes do that, or they'll bring a lunch with them or something. A plan of care, which I'll talk about in a minute. They don't, go through the specifics of that. They, have activities to keep them involved. Transportation is usually provided by the caregiver. Some churches may, have them available, but mostly they'll be taken there. And now Adult Day, there's kind of two models. There's a social model and there's also a health model. The social model is for those who are more independent with their care, don't need as much assistance. They're earlier possibly in their disease progression. They are licensed by the Department of Community Health. So there is training and things that are required, and the state looks for those. They offer activities, social things. Sometimes they'll have, field trips and things going on. They'll provide meals. A plan of care is not required there, so they don't get into person-centered care. It's, more activity calendar based. Some of them will provide transit. Caregivers could bring them, or private carriers, and they do have a cost associated with them as well. And then Adult Day health centers are kind of the most inclusive, where they can take care of the most diverse populations in terms of where they are in their disease progression. It is licensed by the Department of Community Health. The trained staff, you're required to have a registered nurse on site at all times. So there's clinical staff to manage. So it's kind of step two, as people might, though we have people very earlier in their progression here. There's lots of activities going on. Meals are provided. Some will have lunch, some may have lunch. Some have, like ourselves, would have breakfast, lunch, and a snack when you're open longer. There is a plan of care that's a very person-centered plan of care where we look at the needs of each individual, and there are several different types. There's activity plans, there's clinical plans, there's behavioral plans, all kinds of plans of care that are based on each of the participants. Transportation is either provided by the center, the caregiver, or a private carrier, and there is a cost associated with that. So those are kind of the aging programs that are out there that are specific towards an aging population, or those with mild cognitive impairment or need socialization. The adult day services that are provided, there's all kinds of, they're here all day and in a social setting, so they get social interaction, mental stimulation. There's lots of activities. We have a calendar, every day of what we're doing, the meals. The difference with the health part is really that we can care for them as they progress in their disease and if they need more assistance. Most of the social models, if you need help with personal care or you have clinical needs, it's not appropriate in that setting. They may not have the staff to be able to assist with it. I'm amazed at how many places, say they will care for people who have mild cognitive impairment or a dementia diagnosis, but when you start referring to some of the symptoms that they have, they may not be able to care for some of the behaviors that are associated with it, or as they lose the ability to care for themselves with personal care, need help in the bathroom or help completing activities. But in adult day health, that should be a setting where that can occur, where they get meals. We offer on-site physical, occupational, and speech therapists through contracted vendors who come in and help with that. We do vital checks. Each month, we, monitor their weights and their blood pressure, and ongoing if we ever see there's anything going on that doesn't seem right. In a health setting, you have the nurse there to evaluate, to try to catch things earlier in their progression, such as a urinary tract infection or things like that. We have the nursing staff to handle that, distribute medications if they need those during the day. And the social model is more just social engagement and activities without the clinical component to it. The benefits of adult day. So as it said earlier, these adult day services were both for the care recipient and the care partner. That was the intention, to reduce caregiver burden and to give activities and keep the participants safe and engaged as well. So the benefits for care partners is, an improved quality of life. It gives them a break from their duties. I've been a caregiver myself, and those moments where you don't have to worry are so special and meaningful, and really where you can focus on other things that need to happen throughout your day. It helps prevent burnout and stress levels. It improves the care that you can give because you have a break and a breather. Let's see, you stay healthier, not to read all of this, but it just expands things and it gives you time to take care of yourself, because it's so critical for caregivers to take time I know, like I said, I've been a caregiver, so I know how hard that is to take care of yourself when your loved one needs care, constantly, or is in a place where they need more than you do, and your heart is to give it to them. But especially with Alzheimer's and some of the dementia diagnosis, caregivers are at such great risk um, of having something critical happen to them just from the caregiver burden. But because I was at the University of Georgia with the Extension Service, I really researched. We weren't allowed to do anything that wasn't research-based. Here we're in the middle of our latest impact, measuring impact to see what we're doing, where we need to improve. This is kind of a cumulative diagram here, as you can read. So this is a question that we ask caregivers, and we measure their overall health in terms of 10 different areas: their feelings of happiness, quality of life, sleep patterns, their ability to take care of personal matters, ability to work, to take care of other important relationships, their personal health, their self-care, socialization, finance, and stress and anxiety and worry. And we ask them, since they have enrolled their individual at our program, or I would say this would go across boards for other adult day programs, how is their personal overall health changed in respect to those areas? And we never know, but you can see, down at the bottom, I don't know if you can see my arrow or not, but improved significantly is the blue, the lighter blue. Improved is green, no change is purple, declined and declined significantly. And I'm always so amazed at the difference that just getting some help and respite has in the caregiver's life. And you can see most of it is improved significantly, that has been reported. There is some decline, you see, as to be expected with finances. Some people improved. Maybe they were hiring outside help, and adult day, as you'll see later, is less expensive than outside help. I don't know what the circumstances are, or there was no change. And as expected, if you haven't been paying for help or care in the past, that would, of course, you would have some decline. But this is just, an example of how it's helped the care partner or caregiver, whoever is caring for them, how they've seen adult day services help them and their own personal health. But there's also benefits, of course, to the participant while they're here. I'm always amazed. Sometimes we do see improvement with them, but it breaks their cycle of loneliness and isolation. It makes me super sad. So many times when someone receives a diagnosis of dementia, they start having trouble communicating or finding their words. A lot of times they become shut in and afraid to go. I've seen it so many times in my own personal life and with family friends. And then here we hear the stories over. It's challenging to get out with their loved ones or themselves, because they don't know if they're going to remember how to get to the car or where they are. So this just gives them somewhere to go outside of their and away from, I tell some of the husbands and wives, this is a place to get away from someone and be around friends. It has activities to challenge their mind. We do things for the mind, the body, and the heart throughout the day. We have patterns to the day, structures to the day where we do those things. It improves their mental health, lowers risk of depression. We have families tell us that when their loved one's not here, they either sit and watch TV all day, because that's an easy thing for their brain to do. They may sit in a recliner, sleep. We have some that don't even like to get out of bed, but on the days they come here, they are very excited and they get up. We hear that so frequently. But then again, to show you the research. Now, when I first did this, the first year we did an impact, I honestly felt like we're working with people who have progressive diseases. They are going to progress. That's the nature of many of the dementias, the Alzheimer's, Parkinson's, Lewy body, frontotemporal. We do have some people, that have had traumatic brain injuries or developmental that may stay the same, but I've truly felt like this was going to just show significant decline and decline over time. The people who fill it out have been here, some of them for less than a month and some for over a year. So it's kind of a mixed. I didn't tweedle down for you in the specific changes. But as you see, I would have expected a lot of this darker color and dark blue for decline, and there's very, very little decline. There is a lot of no change, but there is improvement, and there is significant improvement that's seen across many areas, even in terms of memory. We've had some people report improved significantly or improved. To me, this was like, I really wasn't expecting it. It was testimony to what we're doing, what the other adult day programs are doing, that it does make a difference for not just the caregiver, but for them while they're here. The caregivers are seeing some improvement or at least no change, which, for some that is huge and significant, that there's not any change. They know what to expect and they kind of get used to it. But I thought it would be really important. So yesterday I was preparing for this and I was talking to our friends and telling them what I was doing. And I said, so what do you all have to say? I feel their input is so valuable. They still have so much to say and share. We added up the years of wisdom that we had within the group, and it was like almost 2,000 years of wisdom that we have at any given day when you add up the ages of everyone that's here. And these are some of the things that people said yesterday that they thought they wanted to share. The we can do it. This is from an individual who came in tears and loathing and so much anger. Honestly, this is not what anyone wants, right? You don't dream of one day having some disease or something that requires you to go, into another type of school setting or work setting. But, unfortunately, where we are with dementia in the world and people working and the sandwich generation, it's something there. But she changed. She loves it. She's been here for a while, and she wanted to say that we can do it. And that was very empowering for her. And I was happy to hear her say that, because she was one who this was not her choice, and she made that very clear. And now it is her routine and her structure, and they wish we were open 5 days or 7 days a week. Some people are, just looking for something to talk to. They're living with a child that works during the day, and they get awful lonely and bored staying at their house. I love Lee, was an individual who came here, and she lives with her daughter, and she talked so many times about how generous her daughter was and how blessed she was to be with her, that her daughter would take her to her grandchildren's games and to lunch with her, her friends, and she'd take her places all the time, to see the things. But she said, you know what? I just love this because this is just for me. Like, I come here because it's for me. It's not for a grandchild. It's not for my daughter, or it's not for, a son-in-law or a son. This is for me. And, I also loved Randy's, that he got roped into it by his wife, but he's very happy with it. It can be challenging at any senior center, anything. Those first steps can be very challenging, but we'll lead them on a journey where they do thrive and do well. So I thought that was important to share what they have to say. So when do you consider an adult day program? For care partners and for care recipients, just any time, there's lots of times, to think about it. If you're lonely, isolated, if you're feeling burdened, if you need a breather for care partners, any time is a good time to consider anything outside of the house and interventions. For care recipients, if you're starting to see behaviors, anxiety, routine and structure so critical. And I know, with families, it can be really, really hard to maintain a routine and structure when you have kids going in a million directions or you're working. You have so many obligations caring for a parent or a spouse when you have a lot of things going on, and that routine and structure is so critical for their day, for their expectations. We do the virtual dementia tour, and when you start seeing people do things, it's just because they'll talk about how they just didn't know what they were supposed to be doing, or they needed something to do. So anytime for the care recipient, those are good times when you see that routine and structure is needed and you don't have the time or the capacity to be able to do that. The adult day program or senior centers or anything can give that structure to their day, and they sleep better, as all of the other things, the improvements you can see. Now, I hope this works. I usually draw this out in person, but since we are doing a presentation with the slides, I'm going to I'm a very, very visual person. And this is what we've kind of observed. So if this graph is your time, you have your time down at the bottom, the amount of time that goes by, you have your disease progression, and you have your caregiver burden. And we know that with especially any of the dementia diagnosis, that over time, the disease is going to progress and get worse. It's going to go down. And we also intuitively know that as their disease, requires more help and they need more assistance and they become more anxious, that the caregiver burden is going to go up. Just over time. I'm not going to put any time frame on it if you want to put your own time frame on it, but just over time, that's going to happen. Where these two intersect is what I like to call the crisis point. It's where your loved one is at a point and you can just barely take care of them and yourself, and you're in a crisis. Usually at this point, I would say most people would start looking at residential care or other options because they can't take care of them, that memory care may be an option for them. So we have X amount of time to that crisis. And wherever you are, if you're watching this and either a caregiver or a care recipient, there's some amount of time, and we all want that to be very, very, very far away. We don't ever want to get there. We know it's probably there somewhere, but we'll do what we can to keep from getting to that time of crisis. So then I want to present to you what can happen with that amount of time with interventions. And interventions, there's lots of research out there on any interventions to help slow the decline of the disease or to improve caregiver burden. Adult day is just one of them. It actually has a lot of the interventions wrapped into one big present. But, this can be as simple as eating healthier, exercising, having mental activities, trying new things, taking classes. Huge important one is socialization. Getting out there and being around people. It has, like I said, there's a tendency to isolate because you don't know how people are going to respond or act. But isolation, whether you have dementia or not, there's huge studies coming out now that show that social isolation is bad for your health as smoking. I think they say 15 cigarettes a day. So if you track it over time, if you stay socially isolated. So for anyone, social and activities are super important. So let's say we start one of those interventions, at this point right here at the very beginning, earlier in the disease progression. It will slow, research has shown it will slow the decline of the disease. So now we kind of have a new trajectory that we're looking at. I didn't go with the best case scenario and I didn't go with the worst case. I just kind of averaged the two out, went down at a 45-degree angle or something as to that disease progression. And as the disease is slower, all things remaining equal, the caregiver burden will also slow and decline. And that crisis point moves out. If it's just a law of averages here, you get twice as much time. You can buy twice as much time to that crisis point. That's pure math. That's just using the law of averages there. So then what we get a lot of times is, if I just go back for a minute, what you'll find a lot of times is people, one of the biggest barriers to adult day health and other interventions that cost money is this thought that I've got to save my money. I don't have the finances to do it. I need it for later if we need memory care, or if I need more care, I need to hold on, and save my pennies as best I can. And that is true. It can be expensive. When you look at, this is the monthly median costs nationally for different types of assistance as time goes on. If you get in-home care, someone coming in to help you with your loved one, those can be, $5,000. That's based on 44 hours of care at home during the week. If you look at community and assisted living, adult day health, you see is the least expensive option. Its average is about $1,800 a month. That would be for 5 days of care at an adult day health facility. Assisted living is somewhere about $5,000. And this is in the Atlanta area is where these figures have been taken. And with nursing home facilities, a semi-private room and a private room. They don't have memory care in these figures. I'm not sure why, but you could guesstimate, most memory cares are between $7,000, $8,000. They're kind of in here more closely related to the nursing home facilities than assisted living, because they're assuming they're kind of independent at that point and aren't flight risks or behavior things. So adult day health is really about 20 to 25% of the cost of memory care when you look at it on average. So if we revisit this kind of graph that we have, so you can buy, say you're going to start your intervention right away. You're like, okay, I will invest a little bit. If you didn't do anything, if your crisis point was here and you had to put them in memory care, we're going to use this amount of time as memory care, the cost you would have for memory care kind of going out. And now you're going to invest in some type of intervention, adult day health, if that's your intervention of choice. It could be 25% of the cost. So you're going to invest 25% of that here. And then, where you would have put them in memory care and had X amount of cost, you have 25% of that here. So when you look at your spending money, it's kind of, what's the famous saying? My dad says, penny wise, pound foolish, or you can actually, doing the law of averages, you can get twice the amount of time for half the cost because you would have had to put them in a memory care if you had done nothing at that point or done something. So you could have twice the amount of time for half the cost. So earlier in the progression is always best. So you may say, well, let's delay the intervention, and that's a good option as well. Let's delay some of those costs, and you can do that as well. So we can move that trajectory down to a point in time, maybe here. You're not at the crisis yet. You're just, letting it kind of go through. So you move that down. We're going to keep it at the same slope, and you're going to move the caregiver burden up. So you do buy time from doing nothing, but not quite as much time as earlier interventions in your disease progression. But you still, it's better than not doing anything. However, so often we get people come to us and they are in that crisis point. They have not done the interventions. They're going to just do it as long as they can on their own. And I said, I've been a caregiver. I know, I know 2020 hindsight, that happens, and you don't do intervention until you hit a crisis. And while we can help at that point, usually depending on what the behaviors and what's going on, the only impact is we can give immediate relief to the caregiver. And that is significant because that gives the caregiver time. Usually it's not a care partner at this time. I know care partner is when you're working together with many of these diseases at some point, and that is so hard for spouses. We see that so frequently, and I know from my own experience as a caregiver for a spouse, care partners way easier. Your partners in this for life, but at some point they're unable to make those decisions for themselves, and that transition from spouse to care partner is one thing, but from care partner to caregiver is another one. And this is where we can give the caregiver at this point in that crisis time to just take a breather, and it'll buy some time and to figure out the next steps there. So the whole point, hopefully that worked graphically on a computer instead of me drawing it out. But the point is, any intervention earlier in the process is going to help. Staying social with friends, finding friends to go out with, taking classes, going to museums, learning new things, anything to help with that is going to be beneficial to you. So then how do you choose an adult daycare if that's what you have settled on or you're looking for that? You need to look at where the best fit for yourself is, proximity. Sadly, there aren't enough adult days out there. I wish there were more. It's such a great option for families. A lot of times, you have to experience it to understand it, but look where you need the support. How much time do you need? Are you feeling anxious when you leave your loved one alone in the house? I helped care for my father-in-law, and even though I was family and even bringing family in, I know my mother-in-law never felt truly safe or in leaving my father-in-law with anyone but herself. We find here that families, because we have the clinical care, we have a safe environment, there's, it's a secured facility, that they finally, for the first time, can take a breather and they don't have to worry about their loved one. They know that they're safe. For the care recipient, are they needing, like I've said, the social, the structure? Where can they find that structure? Does the adult day have a good structure to their day, a good routine? What kind of activities are they doing? What kind of assistance do they need? Do they need personal care assistance? Do they have behavior wandering risks? Are they flight risks? All those things would be things to talk about as you choose, because those will be things to address with the adult day program to make sure that they can care for all of the needs. And I would say when you go visit these places, tour them. If they offer trial visits, that's a great way to get in there. Stop in unexpectedly. I mean, we like to schedule tours here just to make sure, but we can always find someone. It's a great idea. I mean, I do it looking for, alternative care things is, stop in when they're not expecting, see what's going on, see where the staff is. What are they doing? Do they seem engaged? Talk to, our friends or other participants in the program. Sometimes you have to take it with a grain of salt, especially caregivers. We have friends and we have video cameras, so it's really fun. They'll have a great time. They'll be laughing, having a great time, and then they'll tell their care partner or whoever when they picked them up, it was terrible. It was so awful. To try to, because like I said, it's not where you might choose to go, but they all, we've been able to, most everyone has a good time. Look at the ratio of participants to staff, you know, how they, get around the building, are the bathrooms accessible? Just anything, that's kind of common sense when you go and look at what you want for your loved one. Those would be, some of the questions, that I would ask. I would say, just from our experience here, earlier is always better. It doesn't have to be, but when you can have a rational conversation with your loved one about what's going on. We had a care partner who, I loved her thing. It's her job to keep you safe, their care recipients safe and herself sane. They want to be an active part of helping care for you. Having those conversations while they can and having them come here at a point they can rationalize it is always easier. When you go to a crisis, imagine when you're in a crisis, trying to make a change for yourself and then trying to make a change for your loved one in a crisis. They're in a crisis with you. That's just a hard point to bring people here. We see it a lot and we can work with it, but it makes it harder on everyone, harder on yourself, and harder on them. So, how they work with them if they are in a crisis point, if they are having anxiety, how they work together with you. It's very much a working relationship together, how we care for our friends and the adult day programs there. And just if you're curious, the cost of most adult day programs are between 90 and 130. I think I've heard some are up to $150 dollars a day. That should be for 8 hours of care when you compare it to paying $25, $35 for someone, a nursing aide to come in. It's still a less expensive option. Some centers have different payment options, private pay, the Medicaid waiver, if they have the CCSP or the source waiver. If you have Medicaid, those, can be advanced to try to get a waiver that would help cover those benefits for you. The Veterans Administration covers adult day health if they have VA benefits. There are caregiver respite vouchers out there through different not-for-profit agencies. The one in Atlanta is Jewish Family and Career Services offers some respite vouchers. Those are some short-term options, for, a little bit of time. If it's a not-for-profit, such as ourselves, we offer scholarships. Some places may offer scholarships as well. But to look at all the different ways to help cover the cost of that care. And I think, and I'm right on time, I guess, with time for questions.
Christy, that was fantastic. Thank you so much.
Oh,
I didn't know what I didn't know, so I learned a ton as you were talking. So thank you so much for that.
You're welcome.
We do have a question that comes up a lot, and you begin to touch on it, but maybe you can go into some more detail. One of our attendees says, my wife just started attending an Alzheimer's Day program. Every day when I pick her up, she tells me she doesn't want to go back. How can I encourage her to go back?
We do get that. Like I said, it is, I think that a lot of our friends who come here, just to give a little bit of my observation in talking to families, I think they're testing the waters. They know that there's something not right. They're trying to determine what type of autonomy they still have. And so they can have a wonderful, great time, while they're here. And not always, I will say it does take, I say 10 visits is a good average. It takes about 10 visits for them to settle in, get used to the routine. Some people are much better at it and quicker at it. Some push back a lot longer, but on average, I would say, first of all, give your loved one time to adjust. Give yourself time to adjust. And ask the people at the program how they're doing. If we see anyone struggling, we're constantly talking to caregivers, trying to find ways to help them have a better day and help them adjust and get settled into a group atmosphere. Because an adult day is group. I probably should have made it. It's not a one-on-one. They have to be able to acclimate to a group. And then just be patient with them, give them choices in other areas of their life. Like if they're not going to have a choice with this, maybe they can have a choice with dinner or where you go, do something. I think a lot of them are looking for that autonomy and that they can still make some decisions, that not everything, they're not going to be told everything to do from that point out. And a lot of times, if it's not their choice to be coming here, they are going to push back on it just because, we probably, we've only had one or two people who they could not adapt and adjust. Most people can, but it does take caregiver persistence. It's, don't let them lay out, because then they're going to be like, oh, I do have some autonomy if I'm sick or if I'm not feeling well, or if I pitch a fit, and tell them how miserable I am. But that is common, and put yourself in their situation. We always try to have compassion and give them the dignity of their choices. And I personally will talk to them when I see them struggling and just talk to them about where they are and give them at least the dignity of a voice. Is that we hear you, we understand. And sometimes therapeutic fibs are an important part, depending on where they are in their disease progression. To try to help them, feel that they are helping as well. Like you're doing this for your loved one. You're doing this so that they can get to their appointments, that they can work. And sometimes that helps as well. Just showing them how this is what they can do to help their loved one. I don't know if that
answers. Would you say too that sometimes language is really important? So not calling it adult daycare, but
right.
I'm going to the club, or I'm going to the program, or I'm going to work, going to volunteer.
Right. I know that's the technical term for it. We try not to call it daycare. That sometimes brings up like childcare and daycare from children. We try not to use that word with them. We probably, depending on where they are in their disease, we have lots of people who work here. We've even like created paychecks, to give them at the end of the week for coming to work and helping out. So some people come here to volunteer, to work. A social center, a lot of them say they call it a senior center. That makes sense to them. Or a social center, the club. We have some people who call it the club. We go along with whatever the care partner, caregiver wants to use. We try to keep that narrative consistent, the therapeutic fibs, if they're there. It's an educational, we have, that they're in a class. They have to go to a class. They're doing that. This is your class. It's, two separate classes. This is school. So yes, words, but please keep, whoever's helping you, keep them informed. So we're all using the same language and not upsetting the balance of nature.
Thank you so much. Another attendee wants to know what the name of your organization is.
We are Peachtree Christian Health. There's other ones out there. There's a little bit of information on our program. We're in Duluth, Georgia. So, yeah, we do have people. That's why I say, it's great to speak of Adult Day. I wish I could be like, yeah, and go out there on every corner next to the CVS. Sadly, they are not. And there are differences in the programs. We do have people come. I did a little map because we're trying to tackle the transportation barrier. And we have people coming from Conyers all the way up to almost Ball Ground, Georgia, up to Gainesville, Georgia, and Flowery Branch, over down to Atlanta. So it is a very wide spread. So even if we're here for you if you need it, but hopefully there more will pop up and be around.
Where do you find the best resource for a complete list of adult day programs in the Atlanta area?
Well, I would hope you all would have some. I hope that you all have a good list. The search, they're changing so much. I hate to say like one place because it is a hard business to be in. So some days some are here and then they change. There are resource guides around. I would hope we keep in touch with the Gwinnett County Senior Services. They should know about us. Some of the continuum of care agencies would know about it. The VA, if you have VA benefits, if you just ask for the adult day health, they have a huge list. You can go through the Department of Community Health and kind of to do a search there on their website. That's going to give you a ton. And I know that not all of those, are necessarily open. Those are some places that we've referred, but like I said, it's really doing some searching and asking, other people in the business.
And for those of you who are Emory patients, not everybody is affiliated with Emory who's on the webinar today.
Right.
But we do have a pretty comprehensive listing of the adult day programs in the Atlanta area, and you can contact your social worker to get that listing, and we'll be glad to send it to you.
Right. I still think Adult Day is one of the best kept secrets. I don't know why, but it is still one of the best kept secrets for our older adults and those who need a little bit of socialization. So unfortunately, it's not as easy to find as I wish it were.
There are a few other comments. One is my wife attends daycare center 2.5 hours twice a week, 2.5 hours twice a week. It has definitely helped her. I hope it's helped you as well. Sold on the idea of adult day, but finding it so difficult to find quality, well-run, professionally staffed programs. And they give an example of Town Square, which is one of the newer programs in Atlanta.
Oh, right, right.
So I think they are around. They do run the gambit, as Christy said, from very small programs that may only have 3 or 4 participants to larger programs like Peachtree Christian Health. And I just found your description of senior centers versus congregate respite versus social adult day programs versus health adult day programs really helpful for as we look at and try to figure out what is going to be the best for our person.
Right. And I absolutely, if they can get to it, if you get it early, get to a senior center just to get used to that program. They may not be able to stay there long term, but it will help them adjust to environments as you go on, like a step 1, a step 2, step 3, so that it will help them, because, you know, some people don't even want to go to the senior centers, but that would be a good progress for them.
One last question is how many days a week would be appropriate to attend a day program? What about consecutive days versus every other day?
Right. So kind of my rule of thumb when I'm working with families to try to figure it out, research is one thing. Research shows that a minimum of 2 days a week, that's what they looked at with adult day programs, to have a therapeutic effect, to lessen the disease progression and to improve caregiver burden. So that was, you know, a minimum of 2 days per week. However, I think it really depends a lot on where your loved one is in their disease progression, and how much they can remember and comprehend what's going on. Someone earlier in their disease progression that you're doing 2 days is probably very good. And you can pick whatever 2 days you want. Most people try to space them out where they have a few days on, a few days off. As they are declining and struggling with behaviors and challenges, maybe remembering, sometimes, like I said, it takes 10 visits on average to acclimate. So if you're coming 2 days a week, that's over a month. So as you're thinking about it, that's 5 weeks. And as a caregiver, if your loved one's going to come and complain and say how awful it is, that's a really long time for them to adjust. As their disease progresses, that routine and structure is critical. And so I usually say if they're further progressed, a minimum of 3 days, and sometimes up to 5, if that's what it's going to take for them to make the program part of their routine and structure, that they understand that this is it, that there's not the option to sleep in for a few days and then maybe I'll go, you know, depending on where they are with time understanding. So sometimes if they're further progressed, I usually recommend even just to adjust to it and to get in more than 2 days a week. And sometimes, you know, if they're really struggling and further, you know, 5 days a week can help them. At least they know that this is it, and that'll give the caregiver some relief quicker because they'll adjust quicker, and then it becomes a part of their routine and structure. So wherever your loved one is in that, I think is an important piece of determining how many days per week would be ideal.
That's a great answer. Thank you very much.
You're welcome.
There is a question about whether this recording will be available to view. Yes, all of the Dementia webinar series entries are available on YouTube. Sometime between now and a month from now, it will get loaded up to YouTube. So I'm sorry we can't do it immediately today. It takes a little bit of time in the Emory system, but it will be uploaded to our Dementia webinar series section on YouTube, and you can find that on the invitation that you received, wherever you received your invitation to know about this today. One last question, I think, was, are there places that accept Medicaid that you can recommend?
Yes, we accept Medicaid. We accept Medicaid, VA, long-term care. We try to make sure that we have as many options for payment available. But there are, if you have the Medicaid waiver, if you're on Medicaid, you would want to try to get on the waiver, which is the CCSP, which is the Community Care
Services Program.
Services Program. Or the source waiver covers it as well, where you're waiving your right to nursing care, that you qualify, you have the activities of daily living, the needs. You can talk to, if you have that waiver, you would need to talk to your case manager that you have assigned through whichever group you're with, and they can help find a day program for you. Not all will accept Medicaid. Some only accept Medicaid. We try to keep the options open, but they are out there. But the waiver will cover the cost for the program if you have the waiver.
Thank you. Christy, thank you so much. Really appreciate you being here today. It was a fantastic presentation.
Oh, thank you for having
thanks to everybody for attending, and we will look forward to seeing you next month.
Very good. Thank you all. Have a great day. Happy Valentine's Day.
Thank you. Thanks, Christy. That was fantastic.
Oh, I hope.